Welcome to The Explainer. You know, there are some topics that affect millions of people, but they're still surrounded by so much misunderstanding. Intellectual disability is definitely one of them. So today, we're going to peel back those old, outdated labels and get to what it really means. So let's just get right to it. What does the term intellectual disability actually mean in today's world? It's way more than just a label, you know? It's a real clinical diagnosis, and how we talk about it has changed a lot. It's become so much more specific and, maybe most importantly, way more respectful. All right, so to really get on the same page, we need a clear modern definition. Let's break it down. Okay, so here's the official clinical definition. It's what's called a neurodevelopmental disorder. Now that sounds complicated, but it just means it's something that starts during a person's development before they turn 18. And here's the key part. It has two equally important sides to it. The first is about intellectual functioning, things like reasoning, learning, and problem solving. But the second piece is just as crucial, and it's called adaptive behavior. And this right here, this is probably the most important thing to get. It is not just about an IQ score. That's a huge, huge misconception. It's really about the whole picture. It's just as much about a person's ability to handle the everyday stuff. The practical social skills you and I use to get through the day and be independent. Okay, so the natural next question is, where does it come from? What causes it? And honestly, the answer is really complex. It's not like there's one single thing you can point to. It's more like a whole spectrum of different factors. As you can see, these causes can pop up at pretty much any point in early development. Sometimes it's genetic, like with Down syndrome. Other times, things can happen before a baby is born or during birth. It could even be something that happens in early childhood, like a really bad illness or a serious injury. What this really drives home is that there's no single one-size-fits-all story. Every person's situation is unique, and that's exactly why care has to be so personalized. All right, so we've talked about the what and the why. But what does it actually look like? How do these challenges show up in someone's day-to-day life? Well, on the cognitive side of things, one of the very first signs might be a delay in hitting those big milestones we all watch for. Things like talking or walking. Then, as a child gets older, it might show up as having a tough time with things that need a lot of focus, or maybe struggling with memory, or working through a tricky problem. And, those cognitive challenges, they don't happen in a vacuum. They often spill over and affect how a person behaves and interacts with others. Communication might be tough. Reading social situations can be tricky. And you can imagine, right? When everyday things feel frustrating, sometimes that can bubble up as challenging behaviors. Or it might just make someone want to pull back and withdraw. Okay, so we understand the challenges. But that's only half the story. The really important question is, what do we do about it? How do we help? Let's shift gears and look at what we call the ecosystem of care, this whole supportive world built around the individual. And this right here, this really gets to the core of how we think about care today. The goal is not a cure. We're not trying to fix someone. The whole point is to provide amazing, comprehensive support so that each person can reach their own unique, fullest potential. It's all about empowerment. So this whole care journey is a super personalized process. It all kicks off with a really detailed assessment. And this isn't just about finding problems. It's also about identifying a person's unique strengths. From there, you can set goals that are specific to them. That leads to interventions and programs that are totally tailored. And this is so important. It all happens with the family and community right there as part of the team. And what's so cool here is you can really see how this is a true team sport. It's this whole network of different experts all working together. You've got a speech therapist helping with communication, an occupational therapist building those daily life skills, a behavioral therapist helping manage tough emotions, and of course, special educators, making sure the learning fits the student. All of them collaborating for one person. It's pretty amazing. So, when you take all of this, the deep assessment, the tailored therapies, that whole team approach, what's it all for? What's the ultimate goal here? I just love this idea because it perfectly sums up the modern way of thinking. It's not just about managing symptoms anymore. The focus is totally shifted. Now it's about empowering the entire support system, especially the family, to help unlock that person's completely unique potential. So when we look at long-term support, it's all about being practical. It's about building real-world skills for independence. We're talking about everything from self-care and social skills, all the way to job training for meaningful employment. It's a whole-person approach that, crucially, also includes supporting the caregivers and making sure that person is truly a part of their community. So look, understanding the definitions, the causes, the models of care, that's the foundation, right? But it all leads to a much bigger question, one that's really for all of us to think about. How can we, in our own lives, help build communities where every single individual, no matter their ability, is genuinely supported and has the chance to thrive?